Unfortunately, in West Virginia, we have a significant cardiac disease burden. Unfortunately, even despite the best of care, patients' heart disease can progress to the point where they are going to need a heart transplant. And you see a lot of people die from heart failure not having another therapy. Being able to get into a field where you're able to offer that next step is really rewarding. If we've exhausted all of our options and treatment, and they're to the point where they still have significant heart failure, and despite aggressive medical treatment, what do they need next? What's in our tool chest to be able to offer? We are able to take those patients from being really sick in the hospital to a heart transplant and care for them and get them back to really living a normal life.
My name's Everett John Hoffman. I'm a recipient of a transplanted heart from WVU Medicine and the Heart Transplant Alliance. It's just been an unbelievable experience. I've got a new lease on life. I've got a mission I still have to complete, and I'm excited to continue on and to do that. Thankful for all the services that the WVU Heart team put together to put me together.
We've been extremely successful in heart transplants. Our outcomes are some of the best in the country. Prior to us being here, patients had to drive 6-7 hours to be able to see a transplant center. Now they're able to come to Morgantown and see us. We've been able to use telemedicine to make things better for them. But honestly, if you talk to our patients, they'll tell you they like the fact that people from West Virginia are taking care of them. We know what their troubles are, we know what their barriers are, and we have really a whole team put together to be able to work around those barriers and get through them to be able to provide that higher level of care.
The transplant team, the docs, the nurses that worked CVICU, the whole staff, even the physical therapists that came down to take care of me, they were top-notch people. Every single one of them. These were a lot of young nurses, male and female, that were at the top of their game.
Transplant pharmacists, social work, nutrition, finance. We have everything that's specific just for transplant.
After someone goes through the whole evaluation process, we meet as a committee. So it's not one person that decides, is this person a candidate or not? It's not about just saying you can do it. It's about doing it well, and making sure the patients have the best long-term outcome. If you look at the national registry, there's an average of 13 years of life given after a transplant. I have patients that have been alive for 30 years after a transplant. Someone had to die to be able to donate that organ. And so we look at that as probably the ultimate gift. Taking care of the patient is really taking care of two people. You're taking care of the patient that got the organ, but you're also taking care of that person that donated the organ. And that's how you have to look at it. And that's what I tell our patients, saying you're not just living your life now, you're living your donor's life. You have to honor that person. It's important.
I'd been on the side of trying to save lives in some way or another, either directly or indirectly, in the kinds of service that was involved in managing or, directly involved at the technical level. And being on the receiving end was really kind of difficult for me to comprehend that and to adjust to that mentally. I knew for that to happen, somebody else had to be gone.
If unfortunately we can't do things to be able to save someone's life, then we want to be able to save someone else's life. We feel strongly about honoring donors. If you look in the lobby of Ruby, there's a whole wall honoring the donors from Ruby every year.
Patients' lives have been changed. They have a longer life and a new lease on life. It's breathtaking and it's humbling because, the science has taken us to this point.
You take someone that comes to you critically sick and can't do anything, that's almost to the brink of death, and you're able to provide a life-saving but really life-altering treatment, and now they're back living their life, doing everything they want to do. So to me, that's like the ultimate gift that we could provide, and that's why we do it. And I'm proud of our whole team for being able to do that.